and overdose, with most recent years increasing by 56%. Opioid use and overdose prevention are the focus of several community initiatives in Pasco. And in 2019, the Pasco Sheriff's Office started the Behavioral Health Intervention Team led by Captain Tony Roach. The team works to build trust and connect individuals to treatment and mental health. We are grateful for Sheriff Naco's support and the hard work the team does to combat addiction in Pasco County. Today, we are excited to discuss a new program that will add to the continuing efforts and address some of the issues identified in our community health needs assessment. Infectious diseases such as hepatitis and HIV, behavioral mental health, and access to care continues to be our top priorities. The Coordinated Opioid Recovery Network will expand services, creating long-term access to complete care. This comprehensive program aims to address the primary and secondary impacts of substance use disorder. In coordination with many partners you will hear from today, we will be able to link individuals to services through our first responders, offer medication-assisted treatment, testing and treatment of infectious diseases, and focus on a sustainable clinical pathway where individuals will have access to long-term medical home, which includes primary care and dental services. As I know all too well, addiction not only impacts the lives of the individual, but also the lives of their loved ones. I'm humbled to be part of this enormous public health effort. I want to thank all of our community partners for being here today and for supporting us. Today, I am honored to have our State Surgeon General with us. Dr. Joseph Ladapo was appointed as the Florida State Surgeon General on September 21st, 2021. He also serves as Professor of Medicine at the University of Florida, where his research examines behavioral economic strategies to reduce cardiovascular risk in low-income and disadvantaged populations. Dr. Ladapo has been published in leading medical journals, including the Journal of American Medical Association, Journal of American College of Cardiology, and Annals of Internal Medicine. He is a Wake Forest University graduate, and he received his medical degree from Harvard Medical School. As our Lieutenant Governor Nunez has said, Dr. Ladapo has a strong vision to effectively serve the people of Florida. Through his service to our state, we will continue Florida's work to advance our public health goals. Thank you for being here with us today, Dr. Ladapo, and for your continued support on an issue that's so critical to our community.
Thank you everyone for being here, and thank you to you guys and our team from the Department of Health. We have a lot of true heroes in this room, people who believe selflessly in service and have served their communities. So I'm really honored to be in your presence because that means a lot to me. It's very meaningful. We're here, of course, unfortunately, for a problem that continues to ravage Florida and the rest of the country. We're here because of the enormous problem that this country and so many people in this country and in this state are grappling with in terms of overdose and addiction. To put some numbers to it, and in fact, even before I put any numbers to it, I mean, I didn't know that about training, that you sharing that, and I can't even imagine what this must mean to you and what that experience has been. So that's obviously brings this event into more tangibility in terms of its relevance to us, even beyond the rescues that you guys are busy doing, frequently throughout the year. So last year, unfortunately, about 8,000 people died from opioid overdose from drug overdose in Florida. And about 2/3 of that, maybe somewhere around 6,000, 6,500, were opioid related. Everybody's heard about fentanyl now. It's just exploded over the last 5 to 10 years. And fentanyl has been a contributor to the opioid overdoses in just a phenomenal way, unfortunately. It's very powerful opioid. People often only get one strike with it because of how powerful it is. Here in Pasco County, we've looked at the numbers, and it looks as though there were about 3,400 emergency calls related to overdoses, and that was associated with about 1,500 emergency department visits. So a lot of activity here every day on average in Pasco County. So it's a big problem locally, it's a big problem for the state. And Hurricane Ian probably has made it more challenging. We know that the path that leads many people to addiction in the first place is usually a path that's related to unresolved stressors and unresolved traumas that just haven't found a way to get processed and find their way out of an individual, and instead it shows up with addiction, with seeking drugs to numb sensation or to escape feelings and things like that. So Hurricane Ian unfortunately adds to the stress, even for people who weren't personally affected. I think just about everybody knows somebody who was directly affected. So that raises the concern about the relationship that individuals in this state might establish with substances, might establish with drugs. As a response to that, fortunately, the governor launched the Coordinated Opioid Recovery Network a few months ago. So this is a program that I'm really excited about. I'm very happy that we're doing it. I think we're the only state in the country that's doing it, and it does fit with other things we do in this state in terms of going with common sense. So Dr. Shepke was a key architect of this program, and it's not a program that you need a physics degree to understand. You don't have to have spent 10 years in addiction medicine or studying the pharmacology of naloxone or other medications that we use and for people who have overdose or opioid addiction problems. It's a program that takes people in their time of need who are addicted to opioids and connects them essentially immediately to the resources that we know can help them get off that path. So it's not a program where you're handing someone a card, you're asking them to come to a clinic a week or two later, or make a phone call to schedule an appointment. Instead, we're bringing emergency response individuals, we're bringing representatives from addiction counseling, we're bringing representatives from addiction care, so psychiatrists and other individuals who can prescribe drugs like naloxone and other drugs to help people who are addicted to opioids, essentially right to the point of care. So we're bringing the resources to them. We're doing it in a way that's essentially a warm handoff from the patient's intention to get off that path to the treatments that help that individual get off that path. And I'm certain it's going to be a successful program implemented here in Pasco County along with the other counties in Florida that we're implementing it. So we're not doing this alone, we're doing this with our partners. It's a coordinated effort. Included in that is the Agency for Healthcare Administration and also the Department of Children and Families. And we're all working together to make this work, to make this function. I'm really confident that we're going to see some fantastic outcomes as a result of this very common sense, highly effective, well thought out program. And I appreciate your partnership, all of your partnership in making it, bringing it to fruition. So with that, I thank you again, and I want to hand it over to my counterpart, the spectacular Secretary Harris.
Thank you, Dr. Ladapo, the wonderful Dr. Ladapo. Good afternoon. I want to start by thanking the Surgeon General and his team for their partnership on this wonderful initiative. I also want to thank all the first responders here. You all show up in wonderful ways every single day to make sure we're safe, and I just want to thank you for that. It's an honor to join you and so many of our community partners here in Pasco County to launch the Coordinated Opioid Recovery Network. Under the leadership of Governor DeSantis, Florida is a leader in the nation on so many fronts. We're so grateful for him championing this initiative, which undoubtedly is a first of its kind. You've heard the statistics, so you know why we're here, and you know the significance and need for a model like this. For far too long, our healthcare system has had a siloed approach when it comes to addressing the opioid epidemic. It's been fairly easy for one hand to not know what the other is doing. At DCF, we believe every encounter with someone is an opportunity to have a pivotal moment of impact. We try not to underestimate the impact we can have on someone's life if we just leaned in a little bit deeper and took more of a holistic approach in our engagement. The core network maximizes those moments of impact. It comprehensively connects all of the right services, including emergency medicine, hospital services, outpatient treatment, medication-assisted treatment, and peer support services to ensure we are meeting people at the right time and in the right place. We know that substance use is not an acute or episodic illness, but rather a lifelong journey. The core model acknowledges that and brings all of the right partners to the table to address the short and long-term medical, physical, physiological, and emotional aspects of this disease. As the State Mental Health and Substance Use Authority, we spent over $830 million last fiscal year on behavioral health services, and this year we're set to invest over $940 million. So we're hyper-focused on ensuring that we're paying for evidence-based services like the core model. DCF has worked alongside the Department of Health in the design and execution of this model and will continue to support the sustainability of it in the long term. Most people think of DCF as the agency that protects children from abuse and neglect. Of course, we do so much more. But did you know that over 50% of the calls that come into the abuse hotline are for a substance abuse related maltreatment, which can ultimately lead to the removal of a child from their home, which is such a traumatic experience in and of itself. But we know with the right intervention at the right time through evidence-based services, we can keep families intact by building a strong support system. There's no greater feeling than seeing a parent, a mom or dad, enter recovery and become the parent that they want to be and that their child deserves. We're also excited to bring other resources to the table that the department offers for individuals entering the recovery phase. Resources that support social determinants of health like housing instability, food insecurity, and better employment. We know that individuals contending with substance use disorder can become so consumed by their addiction that they neglect these areas in their life. So through the First Lady Casey DeSantis' Hope Florida, a Pathway to Prosperity program, our Hope Navigators will stand ready to work with peer coaches and the treatment team on helping individuals achieve their version of self-sufficiency, so we can avoid preventable relapses due to these kinds of life stressors. Hopefully you can see that the department is all in and we're excited to be a part of this very important initiative. I'm confident we can reduce the devastating impact that opioids are having on our children and our communities. Together we can support strong, healthy, and resilient families in Florida, and I could not be prouder to be a part of this fight. Thank you. I always do this. It's my honor to introduce now Dr. Kenneth Shepke.
Thank you, Secretary, and thank you, Surgeon General. I feel like I'm home here because my background is in emergency medicine and EMS, and I really want to thank all you folks as first responders because you are really on the front lines for this particular disease. And this is a really bad disease. And notice I'm saying the word disease because that's what this is. For too long, we've not recognized this medical illness as a disease, and it's not been treated the way we treat other life-threatening diseases. This is, in fact, a lifelong, chronic, relapsing, life-threatening disease. And as the Surgeon General mentioned, the stats are getting worse and worse. If you look back at our specialty and how we were formed back in the 1960s, we as a society came together because of another epidemic of car crash deaths on the streets. And that's when we as a society said, enough's enough, we need to fix this. And we developed the 911 and trauma system. In the last several years, overdose deaths have surpassed car crash deaths. So we're at another inflection point in society where it's time for us to say, enough is enough. We need to come up with a system of care, like the trauma system of care, to navigate these patients through the healthcare system to get everything they need to help them with this lifelong deadly illness. And that's where Governor DeSantis' leadership, and of course you heard our partners from DCF and ACA, and of course the Surgeon General, have developed a coordinated opioid recovery network. And I couldn't be more proud to be here to help watch this rollout. This began as a partnership with Palm Beach County Fire Rescue, and I have actually here with me Captain Houston Park, where I was serving as the medical director, and back in 2015, 2016, we were in the midst in Palm Beach County of a severe opioid epidemic. And Captain Park came up to me and said, how about we treat these folks with buprenorphine? And that's when I realized, that was the beginning of our journey, when we realized that, you know, we look at this disease differently. And I want you to think about this. Is there any other chronic, lifelong, life-threatening, relapsing disease where you expect the patient to take nothing? I couldn't think of one. So we had the obvious answer. So we had to build a network. We had to build a system of care to navigate the patients through to get them this evidence-based therapy. And we did that. We built a system of care based on the trauma model of care. And the reason why we use that is because the previous system, which was what I call the revolving door of overdose, was the standard of care. Where a patient would overdose, 911 would be called, one of these men and women would show up, would resuscitate the patient, take him to the closest emergency department. The emergency department would continue resuscitation and stabilization. We'd tell the patient once they're stabilized, hey, you need to follow up for this disease, go to one of these resources, basically asking the patient to find a way on their own to get to one of these resources and determine which resource was proper for their needs. The patient would leave the emergency department, overdose again, and the cycle would continue. That's a failed model. So we looked at other models and thought, what could work? And certainly the trauma system, which was where our specialty was born, is certainly the correct model, where if somebody has a severe trauma, EMS certainly is called, they have specialized protocols and treatments and care plans. And then they transport the patient not to any old ER, they transport them to a specialty center where the caregivers at that particular facility have specialized knowledge, training, subspecialty expertise to treat that specific disease. And then when the patient is stabilized at the hospital, they're handed off to long-term rehabilitation until the patient has long-term good, healthy outcome. That's what we're doing here with the Core Network. We're not asking the patient to navigate the system on their own. That's impossible for somebody suffering from this type of disease. The patient now, if they need help, can call. They don't even have to overdose. We bring them into the system, and if they do overdose, we don't necessarily just bring them to the closest ER. We bring them to a facility where the physicians have been trained in this particular disease. The patient gets stabilized. If they require admission for comorbid conditions, that will occur. And then when the patient is ready for discharge, they're not just given a pamphlet and say, hey, follow up somewhere. They are entered into a system of care where this is recognized for the life-threatening medical illness it is. They see subspecialists in addiction medicine, physicians, psychiatrists, social services, internal medicine, because this is a very complex disease, and it's not an easy fix. And as Secretary Harris said, this is a lifelong journey. They may have comorbid conditions. 2/3 of injectable drug use patients have hepatitis C. Many have HIV. Both of those can be treated. In the case of hepatitis C, that can even be cured. 80% have coexisting mental health issues that need to be addressed. They may have food insecurity, housing insecurity. All of those things can be addressed in a system of care, like we do with the trauma system. And every time we've copied the trauma system, and we've done that for heart attacks, we've done that for strokes, certainly we've done it for trauma, every time we have that coordinated system of care, we see a drop in the death rate, and we see a drop in the morbidity rate, and we see good long-term healthy outcomes. And that's why I'm so excited to see Core Network roll out, because I expect the same to result from this. Now, I do want to thank First Lady Casey DeSantis and our governor, because this is a problem that requires a complete solution. It requires prevention, and that's where the First Lady's the Facts Your Future program gets to our youth in high schools and middle schools and warns those students of the dangers of going down this path. It appears that there are some genetic risk factors for developing this particular disease, and the only way to prevent it is to never come in contact with these substances to begin with. So that message to our youth is critically important to prevent these people from developing this lifelong disease, because once they have it, they've got it. And of course, Governor DeSantis has made it one of his programs to increase enforcement penalties against the people that are pushing these deadly drugs on our society. And then the last piece, and what we're here to roll out today, is the Core Network. So I thank you for your time, and I'm really excited to be a part of this. And let me introduce our next speaker, who's going to be Tracy Kaley, Director of Clinical Operations at Baycare.
Good afternoon. As the largest mental health and addiction treatment provider in Pasco County, we are thrilled to be part of the CORE project to continue to expand our efforts to help those who are struggling with opioid addiction. For the past several years, we have successfully partnered with the Pasco Sheriff's Office Behavioral Health Intervention Team to co-respond to calls for mental health and addiction. We are confident that working more formally with both Fire Rescue and Premier, we will be able to, through the CORE project, expand our efforts and identify and connect even more individuals in our community to the addiction services that they may need. Our medication-assisted treatment program combines the use of medications with behavioral therapies to provide a whole person approach to the treatment of substance use disorders. Research shows that this blend of services is effective in the treatment of opioid use disorders and can help sustain recovery. Our medication-assisted treatment program also connects individuals to our full continuum of mental health and addiction care as needed. This includes care navigation, intensive outpatient, detoxification, and residential services. One of the most integral parts of our program is that we connect patients to peer specialists. Our peer specialists are Baycare team members that have been successful in their own recovery process and can then in turn help others who may be experiencing similar struggles. Our peers use their lived experiences and their skills to connect with others who are on their own journeys towards recovery. To that end, I would like to welcome one of our amazing peer specialists, Raylene, up here to speak with you about her personal recovery journey and her amazing work.
Hello, my name is Raylene, and I currently work at Baycare Behavioral Health as a recovery support specialist. My role is to meet with individuals that are struggling with mental health and substance use issues to share my experience and hopefully provide them with hope that recovery is possible. I have struggled personally with drug addiction at the age 23. I had surgery and was prescribed pain medication. I quickly became addicted to OxyContin and Xanax. That addiction nearly cost me my life, as I overdosed many times. I served time in jail because of my addiction. I was in a very dark place and wanted to die. After 10 years of extensive drug use, I finally surrendered and reached out for help. I went to rehab for 3 months, followed by almost a year living in sober living environment. Today, I'm proud to share that I'm in long-term opioid recovery for over 7 years. I have found healthy ways to cope when faced with life challenges, including recently losing my father to a fentanyl overdose. I was able to get through this loss without numbing my pain with substances. I now get to impact my community and help others struggling with addiction. In speaking today, I hope this can touch somebody's life and show them that there is hope and others can find hope too. Thank you.
It's a great story. Thanks. I'm great. It's fun to follow that story. My name is Joey Resnick, and I'm the CEO of Premier Community Health Care, and we are the federally qualified health center here in Pasco County. And our partnership is that, and I will tell you this, is when Trang or Mike calls and they say, we want you guys to be involved with us, the answer is just tell us when to be there. And this one was special, absolutely special for us, as again, from our services, we offer behavioral health, we offer medical, dental, and women's services. And so that's part of that connection. And Tracy talked about with Baycare having their specialized services to help with the addiction. We have some of that as well, but Baycare takes care of that, and then they connect the patient to us and get them into a patient-centered medical home. And so not only are we managing their addiction, but we're managing their whole health. And I think coming from a provider perspective is that's what this is all about, because it's not just about the addiction, it's how do we make them a better, healthy person so they're able to function and get back to life. And if they have any issues, again, we take care of those. So again, we have, from Premier's perspective, is that we don't turn anybody away based on their financial and their ability to pay. We served over 38,000 patients last year, and we have 13 locations throughout the county. And again, it's just an honor to be here and be part of this project, and extremely excited to partner with all of our community partners. I'm now going to turn it over to Fire Chief Tracy.
Good afternoon. Thank you, everybody, for coming out here to Pasco County. Looks like the weather's been cooperating with us today, so we're not baking here in the Bay. But I want to shed light on this project from our perspective. And how long have we been working on this now? Relatively, about a year. Yeah. Well, in the grand scheme of things, a year to develop a program like this is a pretty tall order, and we have a very talented and committed team that made that happen to get us to where we're at today so we can participate. But we also have a lot of community partners. As you can see, many of them are in this room today, and I want to actually shout out to them because they've been instrumental in helping us get this program off the ground. First, I want to start, of course, with our state leadership and all the individuals that came out here to join us today and participate in this press conference. But I also want to thank the Florida Department of Health, the Department of Children and Families, of course, the Agency for Healthcare Administration, our Pasco County Sheriff's Office, Premier Healthcare, and of course Baycare. And there was others, but these are the main partners that we've been working with, like Chief Gwynn just mentioned, over the past year to make today a reality. So in Pasco County, up until now, the typical response for an overdose call is we respond out there in an ambulance similar to the one that's behind me, along with an engine crew, because it's considered a high acuity type call. So there's a lot of resources that are sent to that overdose. We respond, we treat that patient, usually with medication known as Narcan. Then a whole system of withdrawal begins for that patient. And as was mentioned by Dr. Shepke a minute ago, a lot of these individuals don't get the follow-up care that they need, or they're expected to do it on their own, so they don't follow up. And then they end up back out in the system, and the whole system repeats. And a lot of our responses that we respond to day in and day out are repeat customers, unfortunately. So enter now the new coordinated opioid recovery network and the program that we are working on putting together. As also Dr. Shepke mentioned, we will now, as this program evolves, we will treat an overdose patient similar to how we treat currently our burn patients, our trauma patients, stroke, cardiac. We take the patient to a specialized hospital depending on what the issue is. So we will do the same, the idea would be to do the same thing with a drug overdose. So they can get that specialized care that Dr. Shepke was talking about here just a few minutes ago. From there, the patient will be, like I said, connected to a series of medical experts, and the goal is to stop that cycle, right? So they're not going back and re-abusing and then getting back in the system where we have to get involved and start the whole thing over again. So we've been very, very fortunate that Pasco County has been given $1 million roughly to start this program. So we're very, very fortunate in that, and we have been utilizing that to get us up and running. So in 2021, just to put it in perspective, Pasco County Fire Rescue alone responded to nearly 3,500 suspected overdose calls. So, quick math in my head, it's about, 9.5 to 10 every single day. So think about that. Just imagine 10 people in Pasco County alone are going to have 911 called on them because they overdose. So that's a staggering number. And unfortunately, that's nothing new in Pasco, as most of us know. and actually it was much worse in years past. In fact, in 2018, which was just 4 short years ago, Pasco County led the entire state in overdose deaths. So back then, we started working on developing ways to kind of combat that from our perspective, from fire rescue. And one of the things that came out of it, with the help of our Board of County Commissioners here in Pasco County, was some alternatives to opioid pain management. So rather than, if we respond on patients that may be in withdrawal or have, this lifelong disease, now we have a series of medications that are alternatives to the typical opioids that we carry. We still carry them, but we have now 3, and in fact in 2022, currently this fiscal year 23 coming up, we are working on developing even a 4th medication to bring into the mix for those type of patients. So we are very, very excited now to be a part of the core network, because now that's going to take that effort by far to the next level moving forward. And I don't believe, Captain, I don't think you're talking, are you today? Okay, so if you get a chance, talk to the gentleman down here in the blue jacket. He's a former captain, right, retired from Palm Beach County. Right before this press conference began, he was sharing some stories, and they actually have some pictures. Dr. Shepke has some pictures of patients that they've responded on that were overdosed and then have gone through this system in Palm Beach County, because they piloted a couple years ago. And the outcome is just unbelievably remarkable. It's definitely worth hearing the story, and that's just a small sample of the success stories. Now, unfortunately, like any project, it's not 100% successful. But there's way more positive outcome than the negative. So definitely, as we mentioned earlier, we save one life, this whole thing is worth it. So we are very excited from Pasco County Fire Rescue to be a part of this and continue moving forward with developing it and making it even better. So I'm going to turn now over to our Deputy Chief of Administration, Ryan Gwynn. He's going to talk a little bit more about the specifics of what we are doing here in Pasco County in respect with the core network. So, Chief Gwynn.
Thank you, everybody. First, I'd like to thank all the members from the state who are here, all of our county partners, and of course all of our community partners as well for helping make this possible, and of course to the governor for the support that he's provided behind this core program. Just to recap some of the statistics that Chief was talking about, 10 overdoses a day, that's a big number in the county, and if you think about that and let that sit inside your brain a little bit, that's a huge impact to the citizens of this Pasco. Last year, we administered over 2,500 doses of Narcan, and those are the ones that we can count. You can purchase an Narcan from the grocery stores or from the pharmacies, and so we don't know about all the complete total doses that were administered. So, secondly, over the last 3 years, we've seen a 56% increase of overdoses within Pasco County. A lot of those are centered in the west side of the county, and that's where a lot of the population is suffering at this time. We know for a fact that fentanyl and heroin are some of the overdose drugs of choice, and because of that, that's why we're here today. We're going to combat this. Substance use disorder is a serious concern for us. We need a program like this core program to assist in providing the resources that we need to combat these issues. Pasco County Fire Rescue's role is going to be to bridge the gap. So once we transport patients to the emergency room, our job is going to be to bridge the gap from the emergency room to the community partners like Baycare and Premier Health. Our team is made up of experienced paramedics, some of which have nursing background, some of which have home health care nursing background, and we really feel like that's going to benefit our efforts as well. Our goal is to reference the patients that we transport to the ER, make contact with them within 24 to 48 hours after they've been treated at the emergency room, and connect them with the social services they need to start them on the path to recovery. Some examples of those services that they're going to need are treatments for chronic illnesses. You wouldn't think about it, but they're probably going to need dental care, probably going to need mental health care, but more importantly is to enter them into a substance use treatment program. Our response teams will not merely suggest treatments to these facilities, but will focus more on a warm handoff. We're going to actively take an interest in these individuals. We're going to form personal relationships. We're going to assist them in physically going to these treatment facilities. We're going to assist them in the intake processes. We're going to convey the needs of these patients and individuals to the intake facilities. And we're going to make this feel more of an inclusive type of experience that these patients feel valued and cared for, because they should be. So we thank the state and all the partners that we have for the help with this program, because without their assistance, we would not be able to kick this off the ground as fast as we have. And we're glad that everybody's here so we can get started. And I'll send it back to Trang.
Thank you, Chief. Ryan's amazing to work with. I want to close out by thanking everyone for coming today. I want to thank our state office for supporting us. I want to thank Chief Caston for allowing us to use this beautiful facility here. And I am going to turn it over to Melissa Jordan for questions.
Thanks, Tracy. Thank you. All right. With that, we'd like to turn it over to the media to see if there are any questions for our speakers. Yes, go ahead.
Hi, Tracy, Kaley from Baycare Behavioral Health. We have a referral process where anyone who's interested in services can call us. We have a 24/7 line. We have Monday through Friday access line to schedule an appointment for substance use evaluation and treatment, and also mental health issues as well.
Thank you. Dr. Shaw, can you want to take this one?
So the data I'll share comes from the program in Palm Beach County, which is run by the Healthcare District of Palm Beach County. First, let's talk about injectable drug use and the standard of care and the long-term outcomes from injectable drug use, and I'll quote a study as well on this. When looking at injectable opioid drug use, where you treat the patient with no medications, there's a study from 20 years ago that showed that comparing the no medication route versus using buprenorphine, there was a 75% good long-term outcome with buprenorphine and a 0% long-term good outcome from the patients that did not receive medication. Most importantly and instructive from that study was the folks that went to the detox-only arm with no medication. Not only was there no good long-term outcomes, 20% of the patients in that arm of the study died from repeated overdoses. So with the healthcare district, the numbers vary depending on how you look on the months. So understand what the baseline is and where we started. We're still not perfect, but they are running in the 60 to 65% long-term good outcome now. And what we see in the data, and they track all the data, and that's important to note, this is an evidence-based model, and they track, just like all other medical issues that we do, we track it in a very scientific manner. There's a number of things that we call, a number of scores we look at called the brief addiction monitoring scales, and there's 2 scores that you should see drop. They are scores that predict relapse, and certainly we see those drop. And there's another score that we should see go up, and those are what we call protective scores. It makes it less likely you're going to relapse, and that goes up with this program. But the most important number is that when you watch longitudinally over time, the patients that are in the program, after a period of time, we just don't get any more relapses. So the patients, the longer we're in this, the more likely to have really, really good long-term outcomes and lack of relapses. Most of the relapses are up front, and after a few months, they just sort of disappear. So it's been very successful.
Other questions? Locally? In Pasco?
You're putting me on the spot. www.baycare.org/behavioral health. I'm almost positive. Yeah.
that it, Sonia? Okay, she's giving me a thumbs up. Thank you. All right, other questions? Yes, go ahead. Yeah, thank you. We'd be happy to talk to you offline, but we'd like to focus today's discussion on our important core network launch. Other questions? Okay. All right, great. Thank you, Pasco County, for coming together and helping us welcome the launch of this new exciting program. And please join me again in thanking our wonderful speakers.